Hi, this is Dr. Yunhan Kim. The next question we have is low dose naltrexone. Is the mechanism immune modulation or immune suppression? Um, that's a fair question, and the related question to that is, does it mask symptoms or does it get to the root cause? So the answer to that is the mechanism of low dose naltrexone. Naltrexone was developed as an opioid uh, antagonist or blocker. And what that means is that endorphins in the body also get blocked. Now, independent of that action, LDN also as a blocker for toll-like receptor 4, which inhibits the microglia, which is a potent pro-inflammatory agent in our nervous system, I believe also in our immune system. So by the fact that LDN can inhibit microglia cells, that is a mechanism by which it provides anti-inflammatory and immunomodulatory actions. So in this sense, its LDN is very unique. It's unique because it modulates the immune system. It doesn't make it, it doesn't block it, it doesn't stimulate it. It just brings it back the way it's supposed to be. In herbal terms, we call these adaptogen. I've not yet seen a true adaptogen in herbal sense, but the best example of adaptogen for the immune system would be low dose naltrexone. And this is why I love using low dose naltrexone, because it doesn't stimulate the immune system. If it's depressed, it will bring it back to normal. If it's hyperactive, it's going to bring it back to normal. So in either way, it's neither immunostimulatory or immunosuppressive. And the second question related to that is, does LDN mask autoimmune symptoms? What happens to the markers? So the markers are interesting because if I check markers on other patients with long-standing and well-controlled autoimmune diseases like rheumatoid arthritis or lupus, the markers often are negative. So the fact that LDN treatment can result in markers becoming negative, I think it just lends to support the idea that LDN actually is immunomodulatory and it's addressing the root symptoms or root causes of what makes autoimmune diseases trigger. And this is why, for me, in my practice as an integrative medicine physician, functional medicine physician, who use lifestyle, especially keto lifestyle, as a first-line therapy, low-dose naltrexone is really one of the most important tools that in my toolbox. So this is Dr. Yunhan Kim. If you learned something, please give me a like, share, subscribe, and if you hit the bell, then you'll be notified of new recordings I do. Thank you.